Still, please remember that this video is only for general information purposes. For your personal suitable treatment plan and the possible risk, medical decision will be only evaluated by our Dr. Turgut Kayadipe. So with this to be clear, let's start answering the most common questions about rib remodeling.
What is rib remodeling surgery?
Rib remodeling is a surgical procedure that may be considered to improve the appearance of the waist and the torso culture in selected patients. But let's make clear from the beginning, this is not the same as a simple removal fat or liposuction. In some of the people, the lower rib structure itself affects how wide or straight the waist appears. So in suitable patients, the rib remodeling focus only on the lower rib area to address the lower rib area as the part of the waist contour planning. Of course, it is not a procedure for everybody, it's not suitable for everybody. Your anatomy, your health condition, and the expectations must be reviewed by Dr. Turgut Kayadipe before deciding whatever is appropriate for you.
For which patients can rib remodeling be considered?
Rib remodeling can be considered for patients who want more defined waistline and more snatched waistline, especially when the concern is not only the fat. For example, some people lose fat, people lose weight, exercise, and even consider liposuction or even did liposuction before, but the lower rib structure may be one of the factors affecting the overall torso shape. In these selected cases, rib remodeling may be discussed, but the key is here to be sure selected, so the plastic surgeon needs to look to your rib structure, your body proportions, your health history, and the expectation before saying whatever this procedure will make sense for you.
What is the purpose of rib remodeling?
The purpose of rib remodeling is to help to create more shaped, proportional waist appearance by addressing the lower rib area. For some patients, the waist is not only shaped by fat, muscle, or skin. The underlying rib structure may also affect the silhouette. So the goal is not to give everybody the same tiny waist. That would be not realistic or safe. The goal is to see what kind of improvement is possible for your own body structure.
How does rib remodeling differ from liposuction?
Liposuction and rib remodeling are completely different procedures. Liposuction removes localized fat under the skin, and rib remodeling is about the lower rib structure. So if the main issue is excess fat around the waist, liposuction may option for you. But if the lower rib cage contributes to a wider or a straighter waist shape, rib remodeling can be an option for you. In some cases, body contouring procedures can be combined, but it depends on the patient's anatomy, the expectations, and of course, Dr. Turgut Kayadipe's plan.
Which ribs are typically involved?
Rib remodeling usually focuses on the lower ribs because this area can influence the waistline and the torso contour in selected patients. Like it said, it's not a copy-paste surgery for everybody suitable. The same plan that we are using for one patient is maybe not suitable for the other patient. So Dr. Turgut evaluates if the rib cage is too wide, about your waist shape, your body proportion, and the safety factors before deciding exactly how the procedure will be planned according to your expectations.
Is rib remodeling medically necessary?
In some cases, no. Rib remodeling is usually considered as an elective aesthetic procedure. This means that it's generally not performed by a medical assistant, but because of a personal body contouring goal. And because it's selective, the decision should be made carefully. You should understand the expected benefits, the limitation, the recovery process, of course, and the possible risk before moving forward with your plan and goal.
What type of anesthesia is used?
Rib remodeling is always performed under general anesthesia. So during the operation, the patient is asleep during the surgery. Before the anesthesia, the medical team reviews the patient's health condition, your medical history, medications, of course also your bad habits, and if any, the surgical plan. So yes, general anesthesia is used, but the final decision is always made according to the patient's medical condition. reconstruction.
How long does the procedure take?
Rib remodeling surgery usually takes around 2 to 3 hours. In some cases it may be shorter or longer depending on the technique, on the amount of the ribs, because we can choose for 3 or 4 ribs, the patient's anatomy, and if there is also another procedure is performed in the same time in the same surgery together with the rib remodeling surgery. So if the patient asks how long does the surgery takes, the realistic answer is for rib remodeling surgery alone is commonly planned as a few hour surgery, but the exact time will be confirmed during consultation before the surgery in the hospital by Dr. Turgut.
What should patients expect after surgery?
After the surgery, what you can expect is you're gonna stay 1 night in the hospital. We're gonna observe you. In many cases, the patient can stay maybe in 1 or 2 nights. Then, after your discharge, you will stay in our hotel. Our nurse, Melissa, will visit you every day to check how you are doing. We are checking your comfort, your vitals, your breathing, your pain control, and how is everything going. Some patients may have more pain than other patients. It's depending on your pain level. But generally, it is not a procedure which you can simply walk out and continue with your normal day immediately. You need to wear a Victorian corset for 3 months, and you have to take care that you don't sport. And of course, if we perform a different procedure with the rib remodeling, you also need to do your aftercare with like the corset wearing, the fire, after lipo massage. So this one we will tell you all after the surgery what you have to do.
What is the recovery process like?
In the first few days is usual most sensitive part of the recovery. Patients may feel discomfort, tightness, swelling, movement limitation around the torso. You cannot move like this. Most patients need a rest period first, but luckily you're in our hotel, so you can rest before flying back to home. And then when you fly back home, you can start easily back in your daily life. Walking is recommended early depending on the surgeon's instructions, but we want you to walk already 4 hours after your surgery. But bending, heavy lifting, intense exercise and steady movements must be avoided because it can hurt the first months. In the many cases, the main recovery period takes a few weeks, while the deeper healing and the final setting can take a few months. You have to compare it like you break your bone and it needs to heal again.
When can daily activities be resumed?
Most of the patients can usually return to light daily activity after 2 weeks after the surgery, but it's also depending about your pain level and also what kind of combination we perform. But it doesn't mean you can return back to sport, heavy lifting or an active routine immediately. Most demanding activities for your body usually need more time, often several weeks or maybe 1 month. The safety timeline should always check with Dr. Turgut after your surgery because the recovery speed is not for everybody same. So we will give you all the instruction after your surgery.
What are the possible risks?
Like every surgery, rib remodeling has possible risk. These are like bleeding, infections, swelling, pain, delayed laying, delayed healing, scarring, anesthesia related risk and discomfort during your recovery. And of course the aftercare. Because the procedure involves the rib area, so the breathing comfort and safety also need to take it seriously during the planning. That's why this operation should be only considered after a consultation with us, with Dr. Turgut.
Will there be visible scars?
There will be small dot scars because rib remodeling is still a surgical procedure. In our picture you can see it is a very small dot. Their holes are even smaller than the liposuction holes. The final appearance of the scars depends on the location, on the surgical technique, on your skin type. Some of the patients are prone to keloid and of course how you protect to the sun and how you are healing. The scar care is also very important. Patients should follow the post-operative instruction carefully to support a better healing for your scars.
Does rib remodeling affect breathing or physical function?
Yes, this is a very important question. Rib remodeling is planned with breathing and physical function in mind. The surgeon, Dr. Turgut, evaluates the rib cage, the general health and the safety factors before deciding if the surgery is suitable. Also, we are doing this also online when you are far away. After the surgery, the patient may feel tightness and discomfort during the early recovery period, but the procedure should be not planned in a way that compromises normal breathing or function. The coughing and the sneezing is very difficult the first weeks, but that is very normal. If there are any concern, you can discuss it clearly with us and with Dr. Turgut before the surgery.
Are the results permanent?
The structural change created by remodeling is considered long-lasting. However, the body can still change over time. Weight changes, aging, pregnancy, lifestyle, posture, and of course the individual healing can affect the final appearance. And then of course not to forget the aftercare. So it is far to say that the result can be long-lasting, but it shouldn't be described as something completely independent because the body always changes. So please maintain a good and healthy lifestyle to get the best results.
Can rib remodeling be combined with other procedures?
Yes, definitely you can combine with the other procedures. In selected patients, rib remodeling can be combined with, for example, with liposuction, lipo-BBL, reverse TT. So it's all depending on your expectations, and we can discuss this during your first assignment with Dr. Turgut. So just let us know what your expectations are and what your goals are so we can check which surgical plan is suitable for you. But don't forget, the combination surgery is not automatic better. It increases the surgery time, the recovery demands more, so the decision should be made carefully by you and by Dr. Turgut.
What kind of aftercare is required?
Aftercare is very important after rib remodeling. Patients usually need to follow the instruction about the rest, movement, wound care, medications, the compression garment, and of course the Victorian corset. So please follow our instruction that is given by Dr. Turgut. And we will give you a sheet for the aftercare instructions, what you have to follow. Please, this is very important part, so please don't ignore it. The surgery is only one part of the process, but the proper aftercare helps the recovery and the results to be more controlled and support a safer and more controlled recovery. Don't forget, 50% is in the hands of Dr. Turgut and 50% in your hands.
When are the final results visible?
Some changes may be visible early, especially when before the first swelling starts to go down. During a checkup, we will measure your rib. Also before the surgery we will do. Sometimes we already see the first result already, but sometimes after the surgery and the anesthesia, it can swell up so you don't see the results. But the final result takes time. In many patients, the waist contour becomes clearly over several months as the swelling decreases, the tissue settled, and the healing continues. And of course, don't forget the massage. So the patient should be not judge the final result too early. You never come ready out of the surgery room. The early weeks are the recovery time. The final contour can be assessed after 6 to 8 months after your surgery.
What patients consider before deciding?
So before deciding on rib remodeling surgery, you should understand the benefits and the limits of this procedure. It is important to know how the surgery is performed, what kind of recovery you have to take care of, what kind of risks are involved, and what kind of expectation you can expect. This decision should be not only made by looking to before and after pictures and social media videos, because this can give you an idea, but it doesn't replace a real expectation what you can expect. So check with Dr. Turgut what is considered that you can achieve for you results. Thank you for watching. I hope that this video made rib remodeling a little bit more clear to you. If you found it is helpful, don't forget to subscribe on our channel and check out our other videos where we answer more common questions about plastic surgery, medical travel to Istanbul, the patient safety, and always please remember every surgical decision should be made after a consultation with Dr. Turgut. See you soon in Istanbul. Bye!